Well, thank you very much. I appreciate the opportunity to come and talk with everybody. It's very exciting to get out and work with school nurses. I think that you guys are on the front lines for so many things and as somebody who's an endocrinologist working with patients with type 1 diabetes, I am acutely aware of how important you guys are to what we do, so I appreciate that. But I'm going to add one more thing to your list of things to do, I guess. So I hope you don't come to the end of this talk and think that there's one more thing. What I like to think of it is one more opportunity for us to help kids with medical disorders or health issues that I think in a timely manner, in a way that can work efficiently for all of you, to really identify a problem that doesn't get talked about a lot. Just as a show of hands, how many of you know what Turner syndrome is? Okay. How many of you know anybody with Turner syndrome? Okay. All right. Well, it is not one of the things that people know immediately, and it's not surprising. What is surprising, though, is that it is more common than we think. And one of the things that we're going to talk about today is just this very idea that short happens, and why it's important to consider screening and looking at how kids grow and what we could do as school nurses, as physicians, as healthcare providers to try to benefit our patients. So the objectives that we have today are really just to go over some background about what Turner syndrome is, to give you a little bit of an understanding of that, what really to look for with regard to kids, girls in particular, obviously, in this situation, for their growth, why screening is so important, some of the psychosocial aspects of Turner syndrome that doesn't really get given as much view as important as it should be, and is particularly important with the schools and evaluating kids. The nurse as a patient advocate, which you guys already are, but I want to show how important this can be to helping young girls being evaluated for this disorder, and the potential of referral and how to potentially refer patients that you may have seen. So for background, Turner syndrome is a genetic disorder characterized by physical features and a complete or partial absence of the second sex chromosome. Okay, we have 46 chromosomes. 2 of those are sex chromosomes. You either have 2 X's or an X and a Y. If you are missing one of the X chromosomes, you would assume that, well, you know, girls are kind of, you know, good to go. They've got one. Shouldn't that be enough? Well, no, it's not. And you need both of these X chromosomes in order to grow and develop as you should. And when you are missing one of those, this Turner syndrome develops. It's probably one of the most common syndromes that we see, and it occurs in approximately 1 in every 2,000 female births. It was discovered as it always happens in the world of medicine, in a different way. And what happened was that, you know, Dr. Turner identified the characteristics of 7 adult women who did not show development or sexual development at a late age, and he thought that this was uniquely syndromic. I mean, there were certain features that were alike in each of these girls, and he identified them, and this was known as Turner syndrome. Well, Dr. Ulrich in 1930, actually about 8 to 10 years before Dr. Turner, identified these features in a girl, in a girl that was prepubertal. And it was actually recognized to probably be the same thing. So if you go to Europe, they'll often call it Ulrich-Turner syndrome. In the United States, they call it Turner syndrome. So it depends on who you're rooting for, who was the actual, quote, discoverer of this. But the point is that there are certain characteristic features that a girl has that, if she has Turner syndrome, present throughout her life, and it can be identified. The hallmark of this is short stature, and that's really what we're going to be talking about today. Here's just a picture of the karyotype, or just a lining up of all of the chromosomes, 1 through 22, okay? And then you have the extra X chromosomes, okay? So you should have matched pairs of all of these different chromosomes until you get to the sex chromosomes, where you would have 2 X's or an X and a Y, okay? So this is a normal karyotype. This is an abnormal karyotype. We are missing the extra X chromosome. So this girl has classic Turner syndrome. Sometimes it's called XO. So instead of a absent X, they'll just put a 0 there. But there are different types of Turner syndrome, which makes it a little bit more complicated, because there can be actually partial deletions of this X chromosome, where maybe just a certain piece is actually modified and it's not complete. Or there is something we call mosaicism, where there's a mixture of these chromosomes. What is unique about females is that the chromosomes, the X chromosomes, can turn on and turn off, and so there can be different patterns of these chromosomes in each cell. So if there is a mosaic girl with Turner syndrome, it can be certain cells that have just 1 X chromosome, and there can be other cells that have the normal pattern of X and X. And so they can have softer features, or fewer of the features that we would classically see in Turner syndrome. So this is where it gets to be a little bit more complicated, because you would assume that a child with a syndrome, a disorder like Turner syndrome, would be easily identified. They would be able to pick them up. Aha, there you go. They were born with Turner syndrome. We're going to find them and we're going to treat them. The average age for diagnosis for girls with Turner syndrome is about 9 years of age, okay? So it is much more complicated than we think, because of all the different patterns of these chromosomes. And as you can see, there are many, and this is just a very small list of them, but of the most common ones. So 60% of girls have a complete absence of the X chromosome, or one of the X chromosomes. 15% actually have what we call mosaicism, where there is partial deletion and normal cell lines. There actually can be male cell lines, where the girl could have 45X and also 46XY, okay? And that can be is a whole nother issue that needs to be addressed when they come to see us. There can be abnormalities in the structure of the chromosome, where the chromosome is kind of turned in on itself, etc., and still kind of manifesting the symptoms or signs that we see in Turner syndrome. So with that in mind, we have a karyotype, okay, or a genotype, and we also then have the phenotype, okay? When we use those terms, we're talking about the diagnosis within the chromosomes, the karyotype or genotype, and then the phenotype is the look, okay? What would we expect to see in somebody with Turner syndrome, all right? And so these are the things that we're going to briefly go over and talk about. So it's not as easy as you think. So here's a picture of a whole bunch of, early adolescent girls, maybe pre-adolescent. Which one of them have Turner syndrome? Any ideas? Okay. Well, I didn't put it on here, but I actually forgot to put my little blurb here. Actually, all of them have Turner syndrome, okay? Every single one of these girls has Turner syndrome. Yet when you just are looking at their faces, there's not something that jumps out at you. Maybe a little bit as you start to look a little bit more closer, as you recognize that maybe there is a problem. But just on first pass, you're probably going to say, there's nothing wrong with these girls. There's no issues here. But that's why we're having all of you here today, and what we appreciate the opportunity to talk about, trying to find out what we can do to help these girls that may not kind of fit that classic findings. These are some of the most common phenotypic features or signs that we see in girls with Turner syndrome. The most important, though, is short stature. 100% of girls with Turner syndrome, no matter what type of chromosome problem, as we go back here to all these different chromosome issues that we talked about, what we have is that 100% of these girls will have poor growth, okay? And that is the most important feature, and it's really the hallmark of Turner syndrome. Infertility, when you don't have both chromosomes or you have an incomplete grouping of those chromosomes, the gonads, the ovaries, don't develop as they should, and these girls tend to be infertile. Almost 100% of them, but not quite. There's always an exception to that type of rule, but in general you can expect this. Primary gonadal failure, so kind of an early menopause where the ovaries may work for a little while, but they tend to fail early, okay? So that adds a whole host of different problems for young women or older women with Turner syndrome. Osteoporosis, because of the lack of appropriate estrogen. Cubitus valgus, okay, a certain kind of look to their arms, and we'll kind of talk about that, and I'll have some pictures. A low posterior hairline, so the back of the hair tends to kind of come a little bit further down, okay? There is a unique problem with girls with Turner syndrome. It's something called lymphedema, where the lymph fluid tends to cause some of the features that we see, and we don't exactly know why that happens, but there is a lack of appropriate drainage of the lymph fluid in the body, and so there can be swelling and puffiness in certain areas, sometimes on the back of the neck, sometimes the hands and the feet, sometimes in the chest, and so some of the features that we see can sometimes be related to that. This is thought to be one of the reasons why girls have this low posterior hairline. Carbohydrate intolerance, they can be a little bit more at risk for metabolic syndrome, obesity, and type 2 diabetes, but not always. High blood pressure, short metacarpals, okay, so differences in the length of their fingers, and we'll talk about that. A high arched palate, so they can have problems with dental issues, and tooth eruption is something that we see. Structural abnormalities in the kidney. A classic one is something called horseshoe kidney, where the kidneys are actually attached together, okay? But they can also have greater risk for urinary tract infections and things like that. And then hypothyroidism. And one of the things I didn't mention on the bottom of this, below this, is celiac disease, which is becoming much more recognized in a lot of our patients with other autoimmune disorders, in type 1 diabetes as well too. Celiac disease is surprisingly common, and it's something we screen all girls with Turner syndrome for. Turner syndrome, why do they have this? Well, we're not really sure. Probably there is something within their genetic makeup that makes their immune system a little bit less able to kind of differentiate self from non-self, and they can have more problems with autoimmune issues. So celiac disease is a disorder of an intolerance to wheat. It's not an allergy. It's actually an autoimmune problem. Cardiac problems is a very important thing, and this is something that often gets, if you want to think of it as a good thing, it actually helps identify some girls very early in their life as having Turner syndrome, because they may have been born with some type of structural problem within their heart. Okay, not that you want to have that, but it does make it easier sometimes to identify these girls. So 15 to 30% of actually them have coarctation of the aorta, where there is a narrow part of the aorta just as it starts to arch, and that area can lead to problems. That narrowing of that area can lead to problems with blood pressure and the ability to get oxygenated blood out to the body. They can have bicuspid aortic valves. They can have mitral valve prolapse, so kind of a floppy valve that makes them at greater risk for some problems later on. There can be a very important and less well-recognized problem is aortic root dilatation, so that the aortic root can actually be a little bit less strong and sometimes dilate itself. And this has been something that has been recognized as a long-term problem for women with Turner syndrome, because they could develop a dissection of that and have a catastrophic problem. And so this is something that, as an ongoing healthcare measurement, looking at how the size of that aorta is very important as women get older. And hypertension. Ear disorders. Chronic and recurrent ear infections is one of the real common things that we would expect in girls with Turner syndrome. And again, it has to do with the structural development of the ear, the inner ear, and that lymphedema, as I mentioned. So this can be a real problem. Hearing deficits are huge. Almost 50% would be expected to have some type of hearing problems, okay? Again, something that you guys are well aware of in some of your interactions with girls and kids. Hearing deficits can, if they're not picked up early, can lead to some real problems. So a disturbed relationship between the middle ear and the eustachian tube, and then some of the anatomy of the back of the mouth and the throat can be an issue. So all of these issues can lead to problems with recurrent ear infections and middle ear problems. Strabismus can be a real issue. So kind of a lazy eye is something that we can see in girls with Turner syndrome. And it is very common. Up to 33% of those patients in one study actually had problems with some type of ocular issue. Moles, okay, nevi, are particularly common in girls with Turner syndrome. It doesn't mean that they're going to develop a malignancy, but it just seems to be there is a derangement or a problem with the melanin, okay, in the skin, and moles are very common all over the body, and you would expect them in a certain count to be much higher than just the general population. So another thing that can be looked for in girls with Turner syndrome. Nail dysplasia. So looking at a fairly normal nail here, and then looking at a dysplastic nail here, what you see is that the nail is very small. It can be actually somewhat deformed. Sometimes you can actually see a kind of an up-curved tip to the nail itself. And so another subtle finding, but very important to look at when we see patients. This is the short metacarpal that I talked about. If we were all to make a fist right now, okay, and you were to look at the fourth metacarpal, you would expect to see kind of a fairly well-defined bump, okay? But as you can see here, there really isn't, okay, in this girl. And what that is, and I don't think I put that slide on here for sake of trying to make sure this is short enough, is that this bone right here, this metacarpal bone, is actually short, okay? So you can measure that. If you were to take a straight edge or a straight line and touch this, your third metacarpal with your fifth metacarpal, you're going to run into the fourth one, okay? If you can put something flat that covers both of these and the fourth metacarpal is below that, that's something that we can see. And a few other disorders you can see that. If anybody's finding that they have a short metacarpal, you probably don't have Turner syndrome, but just recognize that this could be something worth looking at in our patients. Scoliosis, again, another screen that is real common with school nurses to do. 2 to 3% of the general population, but 10 to 15% of girls with Turner syndrome can have this. So very important to recognize. I apologize, this picture didn't show up as well as it should, but what it's essentially showing is a scoliosis in a young girl. The autoimmune conditions that I talked about, Hashimoto's, which is just an autoimmune thyroid disease. It's the most common thyroid disease in the world, but it is prevalent in about 30 to 40% of girls with Turner syndrome. Graves' disease is actually a similar autoimmune disorder, but it's an overactive gland, okay? And so you can have girls with Turner syndrome that can have an underactive or an overactive thyroid gland, and celiac disease, as I mentioned. So, with that in mind, if you have a girl that has some of these findings, the things that we're looking at, and you see that 100% of girls with Turner syndrome have short stature, what we're hoping to do by this awareness, by the Turner Syndrome Society of the United States, kind of having this message out to as many people as we can, if you see a short girl, we want you to think Turner syndrome, okay? That doesn't mean that every girl with short stature has Turner syndrome, by no means. I see a lot of kids who come in to see me of a short stature, and they're completely fine and healthy, and we don't do anything. But what is so frustrating and what is so disappointing to families sometimes is that we are making this diagnosis of Turner syndrome so late that we may not be able to achieve the heights that we would hope to, and a late onset of puberty and a late onset of therapy can lead to some real problems. And so the earlier we identify these girls, the better they're going to be, and the more able we're able to help the families. And so this is why we're really trying to get this message out. So you see a short girl, we want you to think that Turner syndrome might be worth considering.